Yeah, so hello and welcome this morning to our session on multi-stakeholder collaboration in global health, science meets implementation, with four distinguished and very experienced panelists that will be introduced later. My name is Walter Bruchhausen, and Professor Johanna Hanefeld from the German Alliance for Global Health Research will moderate this session, and therefore it is hosted by the German Federal Ministry for Education and Research that is funding our alliance. So the session will consist of several rounds of questions and answers, first to the panelists, and after the second and the third thematic round, you as the audience will have the chance to pose your questions in the question and answers box. We will read it out for the panelists and the audience, and then we are hoping for a lively discussion. We have decided not to have long speeches by all the panelists, but we want to have really their personal experiences and their assessment of what is needed in our field. So first of all, Johanna Hanefeld and me will introduce our own perspectives, also the motives why we had arranged this session. So Johanna, please start with your perspective from a UK background as well.
Yeah, thank you very much, Walter. So I'm, as well as being at the Robert Koch Institute in Berlin, I'm also an associate professor at the London School of Hygiene and Tropical Medicine and lead of its Berlin office. So one of the reasons, and something that we're very much actively trying to foster and explore as part of the platform, but one of the reasons we were so keen to organize this session is really to see how we can build, or how one can build and draw lessons on how to bring together humanitarian and intervention with research as practice within the spectrum of global health research, which we know has by its nature has to be interdisciplinary to address the really big global health questions. And I think what we're exploring and seeing with the Global Health Research Alliance is very much trying to understand how can you not only foster interdisciplinary working, but how can you also use the momentum and the great expertise and engagement of countries such as Germany in collaboration and assistance with low and middle income countries as a vehicle for research. A vehicle makes it sound a little bit funny, but really to build on the already excellent work being done, but to gain scientific insight and really learn the lessons and build the field as we move along in that. So from my side, I'm really looking forward to today's discussion. Walter, I don't know if you want to add or if we should move to introducing our panelists.
Well, yeah, so I also would like to introduce, to present my perspective from a rather German experience. So the definition of global health that has been put forward by the Consortium of Universities in Global Health and the article by Copland and others in 2009 is still important for global health academia. And this definition says that global health is an area of study, research, and practice. But we all know this is still something like an ideal, and there are considerable tensions in this relationship between academia and practitioners. Some would even say there is not even such a relationship at all. So my own perspectives from my experience are first, my work as a medical doctor in several African countries in the 1990s, and later on my work at the universities, several universities in Germany, where I'm a professor for global health at the University of Bonn now. And I have experienced these two kind of jobs as completely different worlds as regards the objectives, the rationale, the funding, the qualification of staff, also the communication. So for example, being critical is a basic requirement in any kind of research, but in certain quarters of development, you are rather put out of the game if you are too critical. So we can observe that agents of development policies and primary healthcare often feel their suspicion confirmed that academia is something like an ivory tower without any familiarity with the requirements of the practice. And on the other hand, many researchers complain that all their proposals and innovations are not taken up in development projects and practices. So also for me personally, it was not possible to find a job where I could do both practice and research. I had to decide for one of them. And then my own research in the development of global health showed me enormous differences between various countries of the global north. So a country like Germany, without a recent colonial past, has not really development academic institutions that are at the same time involved in implementing health projects in other parts of the world. And that seems to be different in other Western countries where there is this continuity since the colonial period, where you have institutions like the London School of Hygiene and Tropical Medicine, like the Tropical Institute in Antwerp or the Institut Pasteur in France, that have always been more involved in research and projects at the same practice at the same time. So it seems to be that the strict borders within public funding might be an obstacle to this kind of necessary collaboration between research and practice. And I'm really looking forward to the contributions by our representative of the German Federal Ministry for Economic Cooperation and Development, Director Birgit Pickel, on the question whether this is true, that there are these borders, and if it is true, how they can be overcome. Differing from this experience with public funding, there is the example, even the role model of Partners in Health from Harvard, which is by private funding, successfully combining research and implementation projects at the same time. And yeah, therefore I also hope that our panelist Caroline Schmotter from the Wellcome Trust will be able to add to these questions whether the private donor has perhaps an advantage in bridging the gap between science and practice. Yeah, and then the last reason why I find this field especially important is the enormous impact that research can have on health. Just a few examples. The economic research of the welfare economists in the 1990s, Jeffrey Sachs and colleagues, was really essential for the development of the MDGs, the SDGs, of Gavi, and so on. So there can be an enormous impact of research results on practical policies. Another field that I'm a bit more familiar with also is, for example, neglected tropical diseases, where the need for new treatment led to a close collaboration between academic research and the control programs in the field. And yeah, I hope that Professor Achim Hörauf, who is a leading expert in this field, will tell us a bit more about the chances, but probably also the challenges of this. Yeah, and then we can observe that in those countries of the global south, where the implementation of healthcare services was part of university research, they sometimes did better than others. And yeah, therefore, I'm quite glad that our distinguished and experienced speaker, Professor Francis Zumaswa, will be ready to share his experiences from Uganda and from a global perspective on this question, how the two can work together and have done this successfully. Yeah, so now we want to go into the round of introductions, self-introductions, and I hand over to Johanna again.
Thank you, and thank you, Walter, for setting the scene so much. Of course, the British experience is quite different to the German one, and we'll have hopefully some chance to explore that with the great speakers. Walter has already mentioned these, but really we wanted to give you a chance to briefly introduce yourself and maybe give us a brief or a snapshot of why you sort of think from your particular perspective what you have add to the question. I've noted that if I'm going by alphabetical order, I'm going to have the two men before the two women. So I'm going to turn it on its head and go to Caroline Schmotter, who's the director of the Wellcome Trust office in Germany first. Please, Caroline, over to you.
Hi, good morning. And apologies for those who have noted that I was a tiny bit late because we make great ideas thrive, but apparently not technology. So apologies for that. My name is Caroline Schmotter. I lead the Germany office of the Wellcome Trust. Wellcome, as many of you may know, is a British foundation that was actually founded in the late 1930s. So even if it's not as well known in every country, it's long history, particularly focusing on funding science. So Wellcome has, I would say, a lot of experience over the decades in terms of funding science, creating partnerships. It has learned a lot. Since the 90s, we have invested in what we call the Asia and Africa programs, which means we have started to create funding programs with research institutes abroad in a focused way. And even there, we have learned quite a bit, I would say, over the years in terms of what works not so well, where do we want to go? And over the last few years, have invested more and more in multilateral partnerships. So what I hope is that I can bring a bit of a perspective, both in what Wellcome as a British foundation and a British funder, so to speak, has brought to a conversation about partnerships and multi-stakeholder partnerships, but also a little bit of a comparative perspective on how that compares to Germany, as I represent the German office of Wellcome, and we've spent the last few years looking closely at how different or how similar some of the funding priorities are between Germany and us. Thank you very much.
Great, thank you, Caroline. Really looking forward to the contributions. And I go next to Birgit Pickel, who is from the Federal Ministry for Economic Cooperation and Development. Birgit, over to you.
Thank you very much, and good morning to everybody here. I'm today speaking from Berlin, though I usually sit in Bonn as Professor Wörer and Professor Buchhausen. So pleased to be with you. I'm the director here at the Ministry for Economic Cooperation and Development, responsible for global health, One Health, and pandemic prevention. And that my directorate also includes the issues of water and sanitation and biodiversity, as the environmental dimension is an important aspect of the One Health approach, which we might also talk about a bit later. I'm very pleased to be with you. I think as Ministry of Economic Cooperation and Development, we are not the Ministry of Education and Science in terms of a ministry that funds basic research as our sister ministry does, but we are very closely involved with many of the actors sitting here and beyond. That so we, as a ministry, we are really trying to bridge the gap between practice and research, as we as a principle, I think, in most of our programs, be they bilateral or multilaterally funded, try to work really evidence-based and with very close systems of monitoring and evaluation, so that we really focus on yes, as I said, evidence, but also results that are informed by the latest scientific news that we have available. So that is a basic principle that we're implementing as a ministry. Of course, we are also funding research, but with a particular view to applied research that is relevant for our work, but also for our partner countries and low and middle income countries. A last point that I just want to make here is that we are also investing quite a bit as a ministry in local research capacity, from research up to evaluation, because we think it's really important to strengthen capacity in our partner countries as part of our mandate as Ministry for Economic Cooperation and Development. I'm very pleased to be here. Let me stop here. We will have another opportunity to give more input later. Thank you so much.
Thank you, Birgit Pickel, and a very important job, especially at this time. So thank you again very much for joining us. And then, of course, one thing is to talk about the sort of northern end of these things, where we think about the scientific questions, and of course, increasingly with our partners in the south. But obviously, this is a dynamic field, and it's important to have that bridge as well, to not see if research and global health is something that's being shaped in the north and then implemented in the south, but rather that's a dynamic partnership that seeks to answer the questions that are most pressing for the global health for the health of the global population. And I'm delighted that we've got with us Professor Dr. Francis Zumaswa from the Africa Center for Global Health and Social Transformation, who really has been a pioneer in this field. And Francis, please, over to you.
Good morning, all. And Joanna, so nice to reconnect with you. We have partnered over the years in different fora. And thank you for convening this particular event, which to me sounds very important indeed. So it is introduction time. Now I am the Executive Director of ACHES, the African Center for Global Health and Social Transformation. And our mission is to promote evidence-based and technically sound policies that are owned and driven by African populations themselves. I founded this organization having seen how the world works, how Africa works and relates to the rest of the world, having been Director General in the Ministry of Health here in Uganda, overseeing the health sector, including having been a donor coordinator for like 6 years. The real issue is how Africa can be a stronger player, put in more and gain more from the global health agenda. So that's what we are about, and that is what I hope to contribute to the conversation now. I've done other things, but I think this is what I bring here. Thank you.
Thank you, Francis. And last but not least, I hope I'm forgiven for switching the order around, Professor Dr. Achim Hörf, Institute of Medical Microbiology and at the University Hospital in Bonn. Please, over to you.
Yeah, thank you and good morning. Thanks for the invitation to this very important discussion round. My name is Achim Hörf. I'm chair and director of the Institute of Medical Microbiology, Immunology and Parasitology, with a focus on parasitology and particularly neglected tropical diseases in what concerns our research there. And I'm also the speaker of the German Network for the Fight Against Neglected Tropical Diseases, or the DNTDs. And in this second affiliation, before the Corona crisis, I used to be in Berlin once a month to have talks with people who are responsible at different levels for the promotion of the fight against neglected tropical diseases. And you all know that there is several ministries who have a strong portfolio in this area, but there's also the German Parliament. We have a parliamentary advisory board that deals with entities, and there's obviously also a big parliamentary board for international health. And I think there is quite a lot of awareness in the German policy making that this is a very important area. And obviously everyone is also aware that this has to cross borders and ministerial, if I may say, silos, which I don't think still exist. I think the last years have seen quite some good interconnection, for example, between the Ministry of Research, the BMBF, and also the Ministry for Bilateral Collaboration, the BMZ. I want to give maybe one example, and this is a project, a regional support project that is headed by the BMZ in the area of Central Africa, the CEMAC countries. But there is also a capacity building component, and this is delivered by parts of BMBF budget, and this works together, and I think this is could serve also as some sort of blueprint for other activities that can be planned together. I think it is just a matter of the planning, and what Professor Zumaswa has rightly said, of course, we also need to, at the planning stage, I think also include the African partners in order to get their needs. This is something BMZ does automatically for the bilateral activities. But I think if we want to set up something in global health, we should do that early on and create a list of our priorities. So much for now. Over to you.
Wonderful, already very thought-provoking introductions, and I hand back to Walter for the first round of questions.
Yeah, thank you very much, Johanna. And thanks for the great introduction round, which has already, I must say, started a bit of what we want to discuss in the second round, the best practice examples. So when we planned this session, we thought, well, we can always complain about problems and challenges and deficits and whatever gaps, but as there are encouraging examples, and some of them have been already mentioned, we would like to have the first round really devoted to this question. So from your own personal experience during your career, your institution, your insight into other programs, where would you see so-called best practice or very positive examples of this kind of multi-stakeholder collaboration for global health research, these joint activities of practice and academia? And yeah, this time I would like to take another order for the questions. So I would like to start with the perspective of the public donor, the public funder, which is in this case the German BMZ. So where would you see those perhaps even role models where you see this challenge of combining research and practice implemented in a very successful way? So, Director Pico.
Yes, it's a pleasure. There are indeed 3 examples I would like to mention. 2 are from our bilateral cooperation and 1 is our multilateral engagement. Let me start with the first one. I think the current pandemic has put us in a situation where public players and science were almost forced to work together, and we have seen that that can work in a very quick and collaborative way under the ACT Accelerator to COVID, the Access to COVID-19 Tools Accelerator, where science, research, public funders, and development institutions have come together to really join forces and see that we get good and quick research, scientific results. We're not at the end of it, but I think the process is important here, and pull it with public funding to really get the process working. So that is a very good example. Of course, there's a lot of pressure, time pressure at the moment because of the pandemic situation, but maybe we can learn from that for the future. And the basis for that is, of course, sound research institutions, in the private and publicly funding that can work, but also multilateral institutions, partnerships, and I'm sure Caroline Schmotter will talk more about that are already partnerships like Gavi, like the Global Fund, like the Wellcome Trust, like the FIND Foundation, and so on, that already work together and have a sound basis in the private sector and also in the scientific community. So that linkage really works. So that's the first example, and I don't want to leave unmentioned that we as the German government are really large contributors to many of these institutions like the Global Fund, Gavi, etc. Second example, we for a couple of years have been funding a program which supports health or clinic partnerships. It's actually quite small funding compared to other contributions you made, for example, to the Global Fund, but it's really efficient because we get German private or public hospitals often linked up with universities in Germany to partner up with health institutions, public and private, in partner countries. Often the maximum funding amount is 50,000 euros, so it's not huge funding amounts, but the way of really getting things on the ground and linking up to research institutions is working really, really well. I mean, in the last, it's almost 5 years, we have supported 250 of these partnerships together with large university institutions like the Charité here in Berlin, but also small NGO-like corporations that really promote global health and primary healthcare, which is really important. The third example I would like to mention, and Johanna Hanefeld is very well familiar with this setup, is the ZEG, which is a rapid expert group which can really go into the field in pandemic situations like we see them at the moment with COVID-19. But they have also been working since 2016, where we link up public institutions like the GIZ, which is quite well known here, together with the Robert Koch Institute, the Bernhard Nocht Institute in Hamburg. Now we also have the Charité on board, and we are working on getting more public research institutions into this cooperation, and they partner up again with ministries of health, with laboratories, and with research institutions in our partner countries, low and middle income countries, to work on public health issues. It has a sort of a rapid response character, but we have seen that this kind of setup can really evolve into a more long-term partnership, which moves into the prevention, long-term research partnership setup as well. So I wanted to give these three examples of our current engagement, which already show that we are in quite a good situation as being linked up between public and private players, and private players includes the private sector and research institutions and non-governmental civil society organizations. Let me stop here. Thank you very much.
Yeah, thank you. Yeah, now the private funder. So what are your best practice examples, the ones you would like to share with us?
Sure. So I think from our point of view, as I mentioned in the opening, we as Wellcome invested early on in partnerships, but learned a little bit on sort of what are some of the strengths when you have what seemed a bit more like a classical bilateral setup. At which point are you able to move much more into country ownership, which was the next phase of the kind of partnerships we've explored, and sort of what then are some of the strengths and potentially also weaknesses of the multilateral partnerships, which we're much more in today. So let me start with the first point. So what we started with in our Africa and Asia programs, where on the one hand, classical sort of bilateral partnership means we funded national institutes abroad in African countries and in Asian countries that would partner with a British institute that we had funded for relevant work, for example, research in malaria or other tropical, neglected tropical diseases. And they would partner up focused on major health problems in that area, in that geographic area, in that community. So one of the successful factors was you could really focus on local needs, on local priorities, and you could enable a very strong transfer of knowledge, of practices between, in the best case, both ways, between the UK institutes and the national institutes abroad. Some of these partnerships, just to give an example, involved institutes in Kenya and Malawi, South Africa, in Thailand and Laos. So it was a set of different geographies, but all of those countries that were keen to build up clinical research capacities. And I would say the best practice of these sort of more classical approaches was that is today still, that you can focus on what these local institutes need and want from the partnership with an institute in the UK. That said, I would say today we would identify a few other best practices that often are better served by other types of partnerships. The first one is really to enable funding decisions to be taken in country. In many of these typical bilateral partnerships where you have, let's say, a global North partner that is funded to partner up with a global South partner, funding decisions are made by either the funder, typically sitting in the global North, or are sort of at least co-made or co-decided by the global North type of the partnership, so the institute that you fund here. Be interesting later on to discuss if that's the case as well with the German clinical partnerships, or if that's already a step ahead. So what we really felt and saw is the more you can localize the funding decisions, the more you are actually true to the purpose of building up local capacity and priorities, rather than to sort of decide from afar what matters. The second one, and that is something that we have, just to say, largely built up with a partnership that is called Alliance for the Acceleration in Excellence in Science in Africa. So it's called AESA in short. So Excellent Science in Africa. And AESA is really a partnership from the African Academy of Science together with NEPAD, a partnership generally for broader economic growth in Africa. And because it is led by the African Academy of Science, it is the African Academy of Science that makes the funding decisions, which scientists to fund in Africa. A second best practice that we have seen is a dedicated focus on capacity building. And capacity building doesn't necessarily mean, take up the best practices from your, chosen institute in the global north. It means actually really focusing on what is the kind of capacity you have locally. What are some of the skills that need to be built locally? And that is an initiative that we fund that is called Deltas. And Deltas stands for developing excellence in leadership and training in science. So the idea is really to focus on things like, how do you manage research? How do you create a conducive research environment? What does it mean to have sort of an ecosystem locally that exemplifies mentorship, leadership, all kinds of practices, up to how to safeguard for corruption when obviously fundings are transferred for science. And Deltas is a partnership where, again, it is run, or at least governed, by AESA and thereby the African Academy of Science. It works with 11 African-led collaborative teams across 54 partner institutions. So it's sort of a network that cascades, but the gravity is locally in Africa, in the African continent, and much of the governing decisions are made there. And so capacities are built that are really relevant on the ground and not sort of defined top down from the global north. And I would say maybe as the very last point is what all of this is meant to lead to is true local ownership. So really funding programs that are owned and executed and prioritized and governed by your local partner. And that is why we as Wellcome have, in addition to funding some very focused bilateral partnerships that are thematically focused and that do produce excellence in science, they have, all of them have rendered major research outcomes. But what they haven't produced as well is local ownership and really the ability for local programs to excel by taking their own priorities and their own decisions. So that's what we hope to move to, is true local ownership as a focus point of how we design and fund a partnership. I'll stop here.
Yeah, thank you. So both of the representatives of funding bodies have chosen 3 examples, and yeah, I'm looking forward to the number of best practice examples that comes from science. So Professor Achim Hörauf, would you perhaps give your best practice examples?
Yeah, I think there are a few. Of course, it comes from science, and therefore it mainly then refers to what the Ministry of Health of Education, so the BMBF, has done. So I can speak from 2 perspectives there. And one is directly designed to the collaboration with African partners. It's called Sub-Saharan Networks. That have out of, I think, originally 70, there were then 5 in the second round were funded with each between 3 and 7 partners and 1 to 2 German institutions. And I think there the idea was from the beginning to do the, as we call it, Forschung auf Augenhöhe, so research at an equal level with ideas from the African partners, with African scientists in the advisory board and in the board that did the final decisions. I think that was already this idea that Mrs. Schmotter has just referred to for the Wellcome Trust, that there is also some ownership. And the other idea, but this I think has yet to be developed more, was because the real ownership, I think, also comes then with monetary decisions that the African partners give at least part of their own internal budgetary priorities to such a decision. So that if there is a strong priority on one or the other topic, that there is also some commitment from the home universities. This, obviously, for obvious reasons, is something that cannot grow overnight. It has to be developed longer. And I think it's very important for the donor that they communicate this on a long-term perspective, because those structures need time to develop, and also the African partners need time to establish themselves into this direction. This cannot just come within the deadlines of, say, 3 or 4 months of a call. There need to be a longer perspective on this, and I think there is, from the donor side, a strong commitment to do that, but also say, okay, if you, for example, if you want to get some infrastructure, we need to have you maybe participate in the building, or get the infrastructure from the ground at the university campus, things like that. I think are these commitments that also in smaller examples in the past have already worked well, and that creates a process of priority making in the thinking of our African partners that is then really true, I think. The other example where we have a long-standing collaborative relationship is the German Center for Infectious Disease Research, or in German, the DEZIF, which is one of the virtual centers that span between 30 and more institutions in Germany, and particularly with the DEZIF, because there is infectious disease. We had already established since 10 years partnerships with African countries, usually the ones that have already been pre-existing on which to build upon. But for example, we have there created a professorship which is paid by the DEZIF and is actually active in Lambaréné in Gabon, for example, in order to really have a partnership where the professor obviously does the decisions in its own right, and he is basically sort of shuttling between the two worlds. So much for now. Over to you, please.
Yeah, thank you very much. What was most interesting for me in the 3 contributions was that the requirements of the practice are mainly brought in by cooperation with local partners, and not by joining forces, for example, with European development organizations. And that's quite an interesting move for the question how you get practice into the focus of research. And therefore, I would like to ask Professor Francis Zumaswa whether this is also his perspectives from Africa, that this research at equal level, as Achim Hörhoff called it, that the experiences from the ground, from the populations in Africa, whether they are really taken up by these kind of international research collaborations. So what are your best practice by examples for this?
Well, thank you. This is a very important session in this particular time, and I really applaud the government of Germany for taking interest in discussing how you will collaborate better with Africa. And Walter, you said you don't have a colonial history. That could be a plus for you in the sense that we are starting from a clean plate, and which can make us go further and faster than the long-term relationships that Uganda, for example, has got with the UK, with Wellcome Trust. I'm familiar with all that Delta studies and initiatives and so on. So really, before I give my 3 examples, let's go to the basics. First and foremost, do our people in governments, political and society, recognize the critical role that research can play in improving the quality of life of the people? By and large, the answer will be yes, but there is a huge gap between practice and theory. The best story I heard about this was from a friend in Thailand, Professor Panase, who talked about the triangle that moves mountains. At the top of the triangle is what we are discussing: research, knowledge generation. But that knowledge generation should be about the people. It should be responding to the needs of the people. That is the other corner of the triangle. And the third corner is politics. And he says that if the research generators are in sync with the people, the politicians just become rubber stamp if they want to be elected. So the real issue here is that whatever research we are doing, what connection does it have with the quality of life of the people? And that takes me then to give some examples. What I have seen really work well here in Uganda. At the height of the HIV epidemic here, so many people were dying and sick from HIV. And the government felt this pressure and set up the Joint Clinical Research Center, whose job was to understand HIV better and how to respond to it. And that center has now grown into one of the largest HIV knowledge centers globally. It has received funding from multiple sources. I'm sure that the German government, one way or another, could have contributed to this as well. And it is become a big institution in the country for linking clinical research to service delivery and bringing HIV pandemic down here, even long before antiretroviral drugs came into place. The second example I would like to give is current. So the first one was inspired by the threat posed by HIV. This second one by the threat posed by COVID-19. The government of Uganda, believe it or not, because of the fear, the panic, the stress that the lockdown was caused by COVID, and the fear that new therapeutics and vaccines developed by the northern people would not reach us. The president of Uganda has put up $5 million from the government of Uganda, and that's a lot of money by our standards, to institute research into vaccines for COVID, into diagnostics and therapeutics for COVID. Here in Uganda, led by Ugandan scientists, and they are partnering with external partners as well. So what I would like to, the message I would really like to give here is that if the government of Germany is able to get into a situation where they would be responding to the identified needs of the African populations. Neglected tropical diseases is certainly a good example. Then we would be going so much further. Most African countries have got institutions here, like in Uganda, it's called UNRO, Uganda National Health Research Organization. In Kenya, it's called KEMRI, Kenya Medical Research Institute, and so on and so on. If we work with those who are then inspired by civil society organizations, for example, like mine, which speaks for the people, does this matter for the people? Then the funding would be directed to more strategic areas than what happens now. A lot of the funds, a lot of these deltas and so on, it goes to academia, African partners, it goes to academia, Uganda Academy of Science, African Academy of Science. It is, that money is going to university researchers. A lot of those university researchers are doing this research primarily for other reasons other than serving the people. They are doing it, they need promotion. To grow from assistant lecturer to professor, you need to publish so many papers. So they do that research, they get their promotion, and the papers stay in their cupboards. Nothing happens to that. A lot of the research carried out now is like that. Then also these universities, they are ranked now. Every year or so, they want to publish, someone publishes, you are number 3, number 5, and so on. And it's based on research publications. So the research which those universities do helps them to do that. They support research so that they can get better ranks internationally and even more money, but it doesn't respond to the needs of the people. my own university here in Uganda, it ranks very high indeed because of the research from deltas and from and so on and so on. So what is my message? As a nun without a background in colonial history and so on, I would really like to urge the German government to find a way of partnering with those national research bodies and work with civil society organizations to ensure that any research is actually responding to the needs of the people and not to the needs of the researchers. Let me stop there.
Oh, yeah. Thanks very much, Francis Zumaswa, for pointing to this really weak point of academia, that it is sometimes too much occupied with itself and not really serving the needs of communities. I had a short look into the chat, which will be only opened after the next round on the challenges. And there were already some points. One is obviously the centeredness on Africa is not really, looking into the whole world, and therefore Southeast Asia was mentioned, Southeast Asia. So perhaps in your later responses, you could also have a broader geographical outlook. And what was demanded in some of the questions, that we should also look at the barriers and the obstacles, will be a part of the second round, and the third round will be on possible solutions. So we will answer this. And now I'm handing over to Johanna again for this second round, and I will be collecting the questions and post them after this round.
Yeah, thank you very much, and thank you already for the really excellent examples, but also Francis for very thought-provoking comments. So I'm gonna try and push our panelists a little bit on the different experiences mentioned. So I think one of the things from the first round I take is that it's obviously important what is the structural support and the support over a longer time period. So I think from the different examples, that's something we heard. I think we've also seen. Many of us will be familiar with the deltas that have been mentioned. I think we've seen the impact of those, but I think what has come up in the last comment of Francis is really that even where you have strong research collaborations that have been built over time, of course, the structure of the system, be it university metrics or so on, is such that may not best serve the interests of the population of the countries where the bulk of the research is being conducted, and be that in Africa or South Asia, or indeed other parts of the world. So, and that for me, I think why I want to take a moment just to mention that is this, because of course the field of global health, not in general, but I think generally is undergoing a sort of very fundamental shift or reconstruction with the debates around decolonizing the field. So what does it mean to actually come from a discipline that has its origin in this colonial practice? And I think that in a way underpins the efforts and also the examples which we're currently talking about. What I did want to ask in the second round of questions is a little bit about experiences of challenges in collaboration. And I think we've heard a bit about research and building research capacity and research collaboration, but it's really about trying to do this straddling between research and practice. And that's sort of saying, how do we ensure that some of the development interventions or some of the capacity building interventions are simultaneously also evaluated? What about the field of implementation research, operational research, from your very different perspectives, being a scientist or being a donor or being at the implementation? And what is your experience between research and practice? So to what extent, in a way, that particular challenge Francis just mentioned, research for research's sake, or how can we come together better in practice between development cooperation and research as fields? Have there been challenges? What are the experiences of the panelists in that? And I'm going to go to Professor Hörauf, Achim Hörauf. I'm going to go to you first. Thank you.
Okay, thank you. That allows me to also pick up the interesting comments that Dr. Zumaswa has just made, and it also refers to some of the challenges. I think maybe starting from what you just said, Dr. Zumaswa, it's really true that, of course, and we know that as well as you do, that for academic careers you need to publish papers, and very often you try to focus on that, and the high-pitched or high-impact factor paper is more important for a research career in academia than really to deliver, say, a diagnostic or even a drug. The challenge here, you asked about the challenges. The challenges to that which you circumscribe, which is translational medicine, is that, of course, there are much higher funds needed until you have your product, you have your drug, or you have your diagnostics. And this needs some sort of donor coordination. And I think this was also something where we started from. Within Germany, there are 3 ministries: the research ministry, the health ministry, we didn't mention that one so much, and the BMZ. And of course, if you put some of the funds together, you can reach more. And even if you have some donor conferences and donor priorities, say with Wellcome or with the Gates Foundation, then you can make sure that there is a little larger and longer term translational focus, say, on diagnostics. I'm always mentioning the neglected tropical diseases because I'm convinced that when you consider equal access to health, so the SDG number 3.8, then the NTDs together with the big 3, malaria, TB, and HIV, are some of the diseases that sort of are a litmus test. So if governments in Africa, Asia, and everywhere in the world do not get the access to these topics first, then the claim that there is equal access to health it cannot really be made. So I think they serve still as a very good example, but they are, of course, not all. There are other areas as well. But my point is, it's very important, and we are in this process actually also in our donor, I think, donor discussion, that we need to go also into the translational field, and BMBF has done a lot of examples like the product development partnerships with DNDi and FIND in Geneva, and also the DECIF, which was definitely created in order to bridge a gap between academic basic research and translational medicine, where a lot of the good products that have been developed a little bit, they die later on because there is no funding. And I think because of the much larger funds that this needs, there has to be a process where donor groups will really convene and say, okay, we are going to do this together because each of us doesn't have the funding, and we need to set up a program. And particularly, and this is what we request, also from the academia side, make these calls early, communicate that, so that the scientists and the deliverers on the translational side can adopt and think ahead, what can they bring together. I think that's very important. I would still think that you have to do this one, but academic career is something that should not be neglected totally. For example, the German Research Foundation, the DFG, since long has a collaboration projects in infectious diseases with Africa. And actually seeing some of the questions, particularly the first one from the colleague in Nepal, the idea came to me that I should at some point bring it in that such programs are actually be enlarged to comprise also Asian countries and maybe Latin American countries where there are also a lot of needs. But here these programs have served to at least establish early careers. I think the program, since its inception 10 years ago, has, I would say, funded PhD work for, say, 100 or so African scholars who are now able to take on academic careers. I think this is a groundstone. You have to do that as well. And then from there on, of course, you have then the partnership. So I thrived 20 years with African partners that all started from joint PhD work, small project, and now developed into something that can take on larger and longer term activities. But I think the long-term money donor groups, I think these are the important points that we need when we go there. This is a challenge that we yet have to solve, I think.
Okay, so challenges around donor coordination and the long-term nature of the funding. I'm going to go to Birgit Pickel next, and I'm going to push it a little bit. I'm going to say, so in the we've heard about the DFG in the British academic system. It is very much the development cooperation very much goes hand in hand with scientific evaluation. So it's not unheard of that the London School gets a very large contract from DFID, the BMZ equivalent, to conduct an intervention and at the same time evaluate that. And I'm saying that from the experience of having been part of some of these large research, they're called research consortia. They're not without challenges in terms of conflicts of interest, but I'm just wondering, I'm curious, what do you think are the kind of challenges in Germany that we haven't seen this collaboration, or that we maybe haven't seen that level of collaboration yet between the German Science Foundation and the BMZ, and are there examples, or are there examples from your practice that where such collaborations are beginning? What's the thinking on that? Thank you.
I think the German setup is really different from the one in the UK, if I can pick up on this example. We are, when you look at it, let me just pick up this immediate point, and then I actually wanted to mention some other issues as well. When it comes to evaluations and independent evidence on our programs and implementation, and of course that starts with the design, not only looking back, but also looking forward. We, since 2012 in Germany, have an independent institute, the DEWAL in Bonn, which has the responsibility to sort of have a broad view on what we are doing as German development cooperation. And they, then again, when they contract out evaluations, they collaborate closely with independent evaluators, but also with universities. I think the setup is really a bit different. Also, not only DEWAL, the German Evaluation Institute, which also we have very strong implementing organizations that, for example, the UK doesn't have with GIZ and KfW, and a lot of the program design is really done through these organizations. But so the setup is really different, and I sometimes struggle with these comparisons across countries. So I do think that we already work quite closely with many universities also in Germany, but because we don't have that sort of central, we don't have a London School of Hygiene in Germany, or do we have something? I mean, it's a really different setup. So, but we do sort of work with a lot of scientific institutions, but maybe we have to work on the visibility also on that collaboration. It's like the federal system in Germany. It's, you know, a lot is happening really also in the field of global health research, cooperation, but the system doesn't always bring up all the fruits of this collaboration. That is my personal observation. When it comes to cooperation with, for example, the DFG, we as BMZ, we have been, that is really our Ministry of Education and Scientific Research that work more closely with them. But we, of course, have been very active in fostering through the German Academic Exchange Service and also the Alexander von Humboldt Stiftung, the training and research possibilities for young researchers and also experienced researchers in our partner countries. That is quite a substantial investment, which I think has brought about a lot of also long-term cooperations in the field of research cooperation between Germany and universities, whether it's really basic research or applied research. Both do apply, and I think that is really important as investment in the capacity, of research capacity in our partner countries as well. And I think we even have done quite a bit of investment in research infrastructure. I must say I don't have a good example on South Asia. It was asked for. I apologize. I can't give one at the moment. But I can say, for example, that with a Pan-African perspective, and I'm sorry, it's again Africa here. We have been working very closely with the African Union on setting up, for example, the Pan-African University, which has a more, it's not public health, but it's quite a major investment in centers of excellence in terms of scientific infrastructure on the continent. I think also with a view to cooperation, Mr. Zumaswa, I really like the examples that you've given from Uganda, and that there are institutes also, for example, in Kenya, the Kemri Institute. I think on a practical level, and this is the good thing, is that always comes with rather long-term funding. We have, for example, engaged on collaboration with Kemri in Kenya, together with the ILRI on the One Health approach, as part of public, as one specific view on the public health issue. And those kind of cooperations are really useful, I think, to build the bridge and go into long-term partnerships and long-term partnerships. That's really what I wanted to say. Last point on coordination. I think Professor Hörhoff has really made a very important point. I think as a German government, we have done much better in the last years to sort of jump across the little walls that have been around. We do collaborate, for example, on the product development partnerships you have been talking about. There is funding from different ministries with different angles. We are now, hopefully, subject to parliamentary approval, moving into a joint cooperation with FIND, where that does basic research on diagnostics, but they also then again need funding for getting things on the ground. That would again be our part as Ministry for Development Cooperation. So that maybe is a good example of where you can sort of bring together research and applied research, and then actually implementation on the ground, so that diagnostics will be made available together with partners, where we have made progress, but I'm sure we can still do better in the future. Thank you.
Thank you very much, Birgit Pickel, and forgive me for sort of pushing so much there, but I think the point you make is exactly, or I can also see this is very much about the structural setup. So you can't have one model for collaboration that works in every country, because I think and I'd be really curious. I'll go to Francis Zumaswa next. Be really curious to hear about Uganda, because certain sort of academic structures have grown in a particular way alongside their funding structures, and I think these ecosystems in a way work as a whole in development practice as well as in research practice, and I think there is probably not one model that we can completely copy. So Francis, you have obviously sort of given some very thought-provoking remarks already. I wanted to come to you really to hear a bit more about the collaboration between research and practice in Uganda, or from an African perspective, but please also, because I'm also conscious of time, we are spending a lot of time focusing on the challenges, and I wonder if you already sort of can give some examples of where you have seen maybe the issue of coordination or so on, those challenges be overcome, or innovative ways of addressing these. So Francis, over to you.
Thank you, Joanna. It's a very illuminating discussion. So I was to give 3 examples. I gave 2. The third one actually is to answer your question. You mentioned operations research. So when I was Director General in the Ministry of Health here, we would have annual meetings with all partners in Uganda, local partners, the National Health Assembly, but development partners would also be invited to these meetings. The Ministry of Health was asked to prepare an annual performance report, pointing out the successes and why, failures and why. And at the end of the joint review, a list of research questions would be raised to answer both the weaknesses, particularly the weaknesses, how can we solve this? How does money come from the center to the district and so on? And money would be put aside to study that problem and propose answers to it. So this really worked very well indeed. And the performance of the sector was really very much applauded, not just here in Uganda, but it became a global model against which the Paris Declaration was partly based. So the message here is that all the countries like Uganda have development plans, national 3, 4, 5-year development plans. And all those plans have a research component in it. And then I mentioned earlier, they also have these research coordinating bodies in the countries. So a practical way for Germany to consider, for example, is how those research priorities identified in the national development plans are being streamlined into the national health research bodies, and where the resources and capacity building for them comes from, and how the German government can contribute. Putting out a call like Wellcome Trust would do quite regularly is one way of getting partners, but I would discourage that in this case, because the people who will be successful in writing the calls, you know them, and they are the ones I referred to before. So my answer, Joanna, to you is that one, that I would like to call upon us to consider strengthening the capacity of national mandated research organizations who are responding to the needs of the development plans of that country. And then the academia also will come in here. They will have roles to play. But then the research priorities will be country-led and not, as it is very often the case now, donor-driven. Thank you.
Thank you, Francis, for those remarks. And I'm going to go to Caroline Schmotter straight after that. Please, Caroline, over to you.
Sure. I don't want to repeat many of the things that have already been said. Of those, I would probably underscore the biggest one being the challenge. And that is not just the challenge in multi-stakeholder partnerships, particularly in the Global South. I think it's a general challenge to think hard about what the actual objective of a science funder in a particular program is. Is it to create excellence, scientific excellence? In that case, you have the scientific standards, you look at the papers, the publishing, and you fund as most do when it is about, creating excellence. That is the same thing here in Germany, where you have debates about, the freedom of science and to what extent, the science networks. Often, to be honest, quite impenetrable for young scientists, also here in Germany, call the shots on who's getting funding and for what. And at the same time, not wanting issue-specific and health challenge-specific, for example, funding, and finding that almost a threat to scientific freedom. And I'm not saying that, one is right or wrong, but I think it is a tension that is generally true, and not just true in the Global South. But I think it's important, as donors look to the Global South, to be very clear what they're trying to achieve. For us in the early days, it was academic excellence with a purpose towards these geographic areas. And our bilateral programs still have that. So for example, KEMRI, which has been mentioned a few times in Kenya, Wellcome has actually funded KEMRI since 1989. So a long time. We have funded a Malawi-based clinical research institutes also since the mid-90s, and funded similar institutes in South Africa, Laos, and Thailand, sometimes since the 70s. So we've really tried, on the one hand, to help create excellence for issues that were localized, such as malaria, for example. Some of these clinical institutes actually rendered one of the most important discoveries in how to treat malaria, and finding more effective ingredients or components than quinine. But at the same time, as I said before, what they didn't do right away was creating the capacity and the ability for the local institutes to actually set their own agenda and to be sustainable with their own priorities. So that's the one thing. I think the other part that has been mentioned is a clear focus on capacity, and capacity meaning both how to run such institutes, how to set agendas, but also how to create a pipeline of young scientists who don't all, who may get educated elsewhere, but either come back because they know they have a career, or who stay locally because they can progress as a scientist. And that is something that Data's Africa has prioritized quite a lot to make sure that young scientists are really channeled through a system where they can either do research at the master's level, PhD level, or postdoctoral level within these 11 African-led teams that Delta's focuses on. One other example, since it was mentioned or wanted to hear more examples from Southeast Asia, we have invested as Wellcome in the so-called India Alliance. That is a independent charitable organization where Wellcome has invested in. We started that in 2009, but the condition was that the Indian government also invests in it. And the idea was to fund again young scientists, but also advanced scientists, to be able to go not only through clinical research, but also to get to the translational element. We haven't talked a lot about that. I think to be relevant locally, it also means that funders need to enable translation. So, great basic science is wonderful, but it actually isn't relevant if you can't draw any therapy or medication out of it locally, ideally. And so that is what the India Alliance is focused on, to both funding early career, intermediate, and senior fellowships, but at the same time also helping them to really get into biomedical research and biotech where possible in India. And the reason I'm also mentioning that, because I think it talks about one of the last challenges that hasn't yet been mentioned, maybe in the same extent, is at which point are funders willing to give up some of the control and the priority setting? And as a private funder, that's of course easier to be said than as a public funder. It's of course a little bit harder to give up control over German taxpayer money, but at the same time, if it's for that very purpose, and I know BMZ is doing that in a lot of its programs as well, local ownership also means less control on the donor side. And in the India Alliance, for example, part of that was for Wellcome to really assess its own risk appetite hard and assess hard to what extent we're willing to let go to partner up with our well-known partners in the UK to create a research agenda from our side, to give ideas on priorities. But we did that in a way where we said the Indian government has to come in stronger if they hope that we give up control. And so control means, on the one hand, something that funders need to let go of if they really want local ownership, but it also means that local governments particularly, and that was said before, need to step up their own willingness to fund. And so the India Alliance, for example, in the first stage, we were giving a much larger portion of the overall funding, or sorry, not a large portion, but we're actually dividing it 50-50. In the second phase now, the Indian government is taking on 2/3 of the funding, and we're just funding 1/3. And the idea is that the India Alliance is becoming a much more locally driven agent where we could fund pieces of it, but eventually other funders come on board, and it is driven by either the Indian government or consortium of funders. And so I think that's the part where it becomes tricky, because we all want to, of course, set priorities to say the research has to matter, the research has to be important, it needs to be applied. But in order to be willing to create this local ownership and sustainability, we all, whether it's we as Wellcome Trust, whether it's an excellent university in Germany that is partnering with a local stakeholder, I think we all need to be willing to give up control and find governance mechanisms that allow us to have some role in the governance, but at arm's length, and to be really clear about the risks we are willing to take and those that we aren't willing to take. And I think that leads me to sort of the broader multilateral dimension. And we've talked a little bit about the Access to Tools Accelerator that was now set up very quickly to combat COVID-19. And that is one of these things where I think, that was built up very quickly and with existing organizations as a partnership. But all of these organizations in the end have a clear mechanism on how to take on funding. Governments and other funders know how they give up control. They then often sit in a board or take rotating seats on a board. but the way that the partnership both is funding research, say in the case of CEPI, where many donors like us or the German government are investing, there is a clear process of the influence and control that we do have as a donor, and there's a clear limit to it. And I think that's the benefit that these multilateral international partnerships have when they look at research and obviously when they look at delivery, where BMZ is very strong at. But I do feel that these are often deprioritized sort of in the political dialogue towards these more bilateral partnerships, and that's something where I wish, you know, the German government has done huge investments in multilateral stakeholders, whether it's the Global Fund, Gavi, or CEPI. But I feel that these multilateral partnerships are still pretty young, and there could be a lot more coming out of that for research. And you know, I hope the German government, especially also the Ministry of Research, which unfortunately isn't part of this discussion, has the appetite to do more of that, or to fund the African Academy of Science directly, and to also, you know, chart new ways where it really means giving up the control, funding a local partner, ideally one that then cascades the money down, and really to empower the local system.
Wow. Okay, that's a whole agenda really there. Thank you very much. Walter, I think we have some time for questions from the chat. We've run a bit over our planned time frame, but I think it'd be really interesting to have something from the floor. I think people have been commenting on these very thought-provoking interventions. Thank you.
Yeah. So with regard to the time, to the course of the very lively discussion, which is a good sign, and to the questions in the chat box. We really have to combine the discussion of both the barriers and the solutions. So the second and the third round are in one now, and there's only about 3 minutes left for each speaker. But I want to bring in the important questions from the box. The one on South Asia capacity building there is extended to the question how to secure access to vaccines, to new vaccines, and that's also supported by a question from the DNDi. So the question also how NGOs could be more involved into health research, and also how countries with a weak research infrastructure so far could also be empowered to get access, because so far the money is rather going to the countries that have already a robust infrastructure for research to absorb it. Then there is the right remark that Germany has a colonial past. As an author of several books on German colonial history and the early German development cooperation, I can say yes, of course, but after the Second World War, Germany had to start from the scratch because there were no many researchers and medical officers with experience in tropical countries. So there is really a different history in this compared to other Western powers. Yeah, and then a question from within the German Alliance for Global Health Research is how researchers could become part of these hospital partnerships, really how research components could be added there, and how researchers could really profit from public development cooperation infrastructure, for example, in GIZ programs. That's, of course, mainly a question to Birgit Pickel. So please keep short, 2.5 minutes, and I say already goodbye because we have to end in time. The strict time schedule of the World Health Summit is demanding this. Who wants to start?
Maybe I can respond to the NGOs one. NGOs are quite important now. They are growing in importance as think tanks and research and advocacy groups and so on. So I would advocate for NGOs to be part of the equation when the German government is considering developing its research agenda. The other questions to me have to a large extent been answered, and let me just stop there. Thank you, and it's been a pleasure to participate.
Thank you very much, Francis, for being short and so comprehensive in your previous remarks. The next one. Man first. Achim, hör auf.
Okay, thank you. Yeah, I may, even though the question has been addressed to Birgit Pickel, I may say something to this question put up by Nora Anton. For those who don't know her, she is at the coordination office for the BMBF part of the funds going into global health. And as you may know, and this is one of the examples where we in Germany really have to improve, there are three pillars of global health activities. One is located at the BMBF, another one at the BMG, so the health ministry. They have the global health hub, and obviously BMZ is one of the ministries that has always dealt with global health. And I think the question that relate to this is very important because it's a real big untapped money. We have GIZ programs and there is good funding there. And we need to put some research questions on top. Dr. Zumaswa has said in their priorities, there were always some research to be developed on top. And I think that is something that it really would make a lot of sense, because all the political priority setting on bilateral exchanges is the core work of the BMZ. And when there is some sort of research questions, which is also important for an evaluation, so how successful are these projects, I think that might be an idea, and of course, sort of say over to the ministries to develop that jointly. But I'm very hopeful, and I have heard positive signals from both sides that this is going to happen, and we just need the time for it to develop. I would also like to answer a little bit on the question that I've put up by our colleague from Asia, Anne Bioshi, who has brought into the discussion the term funding flow trend. And this is, I think, very important. There are always up and downsides to things. So if we fund big existing research institutions, there is, of course, the trend that they collect more money and they grow, and there is difficulties for smaller institutions to grow. And I think this has to be counterbalanced by career development fundings. We have not mentioned Germany's academic exchange service, the DAAD, that in addition to Humboldt for more advanced scholarships also fosters the careers. But it's truly right, I think, what Dr. Zumaswa said, that it needs to somehow align to the research priorities, or at least parts of the fund need to go there. And we have the example from the research networks of Sub-Saharan Africa with BMBF that actually the projects were ranked according to how they would align with political priorities. And one of the ways to do it is to involve the ministry commitment, the ministry involvement. So it should not only reside with academic, but also with the ministerial research organization. There would be much to say. I say thank you for participation and see you later.
Yeah, thank you. So the BMZ, Birgit Pickel, what's your perspective and final remark?
Well, thank you. Just 2 quick points. First, just a small response also to Caroline Schmutter's plea for multilateral engagement. Just wanted to highlight that actually 2/3 of our budget go into multilateral initiatives. So even though I've talked a lot about bilateral initiatives, and a lot of the questions in the chat actually show that that is also important, 2/3 of the funding go to multilateral initiatives. Just very quickly on opportunities to engage more strongly with our programs implemented by GIZ, and I also want to highlight KfW again, because a lot of funding goes through that bank as well. Every program goes through sort of a rigorous assessment, and these assessments are usually done together with partners. I wanted to mention that as well. We often have local researchers on board in project appraisals. So it's not only the German scientific community that is important here, but also local researchers. There are possibilities, but I will certainly pass on that suggestion and question to my colleagues in the ministry that are responsible for GIZ overall. And on the clinical partnerships, there was a question also on how to extend that to research. We're actually in a continuous learning process on this program, and we will sort of bring, as from next year, bring together two programs which were separate so far. One was called University, what is it in English? University Partnership in Africa, Hochschulallianz, and the clinical partnership. So we will broaden the scope, and that will give opportunities to also partner up more closely with universities and research as well. So if you have further questions on that, happy to pass me an email, and I will link you up to the persons that are in this process. I think, looking at the time, I need to stop here. I could talk a lot more. Thank you very much for your attention. It's been a very good discussion. I look forward to seeing you again soon. Thank you.
Yeah, thank you very much. So the last word from our panelists will be from Caroline Schmotter. Yeah.
Well, thank you very much also from me. Big thanks for being able to have the speaking opportunity and to the audience. I think looking at our discussion, my sense is the next step is really to number one, create more transparency upfront what the ultimate goal of each funding partnership is. So it's not just the scientific discovery title, but it's actually quite upfront in terms of, you know, is it for a specific research excellence reason? Is it to create capacity? Is it to foster more local ownership? And I guess a little bit more, how to say, confidence to prioritize between these three. Often funding programs are set up to a tick mark, right? It's sort of everyone, we do all of this, we create capacity and we do this and it is excellent. But in the end, I think a clear focus on what we're trying to achieve is important. I would definitely advocate for more prioritizing more partnerships that have a clear governance and oversight that is localized, particularly such as the African Academy of Science and other regional Academy of Sciences. Particularly where they're regional, by the way, I think they're able to also serve the regions, which has been mentioned in the chat, that are notoriously underfunded because there's no research present yet. There isn't one great institute that can absorb all the funding. But that's what these regional academies of sciences are really good for, because they can actually priorities, they can incentivize local partnerships between neighboring countries and getting more science into regions where researchers are just not able to apply for funding and to get the kind of funding that they would hope for. And I guess my last bit is really about, multilateralism doesn't necessarily mean it's all like a CEPI for everything. I think CEPI gives us a model to say what we have seen, as Birgit Pirkel says, and which is absorbing large funds in the development space, that can also work with research. And in research, I would argue it is still a rather young and smaller share of funding everywhere. And I think we need to let go a little bit of the need for control to be able to create such multilateral organizations. If we look at COVID in the end, we wouldn't be where we are today if it wasn't for an Australian lab that deciphered the genetic code of the virus, if it wasn't for German, British, and American vaccine development, if it wasn't for local clinical trials, right? So we need all of that, and we need to create organizations that serve all of that.
Yeah, thanks very much to all panelists. It was a very lively and informative and constructive discussion. And as I had the first word, the final will be by Johanna.
Okay. Well, I can just add my thanks. Really thought-provoking and many, many things. I hope we can continue. And certainly we in the German Alliance for Global Health Research and the funding platform, we're going to take these discussions forward. And we look forward to working with you in making some of these ideas and principles a reality. So thanks again, and a great virtual session. Thank you. Bye-bye. Bye.
Thanks for your attention.
Thank you. Bye-bye.